So, today Dr. Vani is going to address certain queries pertaining to the process of egg freezing. So, Dr. Vani, our first question is, why would a woman consider preserving her eggs, and how is this process useful?
Hello, everyone. I'm Dr. Vani Sundarapandian, Medical Director of Jananam Fertility Center, and this is a detailed discussion regarding egg freezing. So, what egg freezing means is removal of eggs from a woman's ovaries, freezing them, and then storing them at sub zero temperatures for later use. The first frozen egg baby was born in 1986. Since then, there has been an enormous refinement in freezing techniques. Also, today there is a growing demand for egg freezing. So, I will be answering some frequently asked questions pertaining to this topic.
Thank you, doctor. And if you could just tell us who all can undergo this process.
The women who consider or need to consider egg freezing are women with cancer who are to have chemotherapy, because we know that chemotherapy can damage the ovary irreversibly, and if they haven't had any children yet, then it may be worthwhile considering egg freezing. Number two, women with endometriosis. Now, endometriosis is a disease which can damage the ovary extensively and cause loss of normal ovarian tissue and eggs, and some of them are advised surgery, and before surgery it may be worthwhile freezing their eggs. Now, more often, however, are women who are unmarried and haven't found the right partner yet, and both married and unmarried women who choose to postpone a pregnancy, either because of career, financial, or social circumstances.
Well, Dr. Vani, that was quite insightful. Thank you so much for that information. So, our next question is, what, according to you, should be the ideal age for egg freezing?
That is a difficult question to answer, but it makes sense to freeze eggs in your late 20s or early 30s because that is the time when egg quality is very good. Let me give you an example. If a woman has to conceive naturally at the age of 40 years, her chance of success would be about 5%. But if this very same lady did choose to freeze her eggs at 30 years and have the baby at 40 years, her chance of having a pregnancy would be about 40 to 50%. So basically, late 20s, early 30s is probably the best time.
So, doctor, if I am considering this process, how many eggs would I need to freeze?
That's once again a difficult question, but let's look at the evidence. If a lady less than 35 years old manages to freeze 15 eggs of hers, then her likelihood of pregnancy would be somewhere around 80%. Whereas if she froze 8 to 10 eggs, then her likelihood of pregnancy would be around 40 to 50%. If the lady manages to get 24 eggs, then her likelihood of pregnancy would be above 90%. This is, of course, assuming that the male partner is normal and the eggs have been fertilized with good sperm. Obviously, women who are greater than 40 years need to have more egg numbers for a better chance at achieving a pregnancy.
How can I determine how many eggs I'm likely to get? Is there any test that can help me understand this better?
Yes, there is a test called AMH. Now, AMH is anti-Mullerian hormone and it is a blood test. It can be done at any time in the cycle and it gives us an idea as to what your ovarian reserve is. We obviously cannot predict the exact number of eggs we will be able to get from you, but we will tell you if the value is normal or not. AMH does not give us any idea about egg quality, and the only determinant of egg quality is your age.
So, Dr. Vani, what process would I have to go through for obtaining the eggs that I need to freeze?
Let me explain the process briefly. The ovaries have follicles within them. Follicles are fluid filled sacs which contain the eggs, and you tend to have a larger number of follicles when you have a good ovarian reserve and a lesser number of follicles in women with a poorer ovarian reserve. Now, normally, that is in a natural cycle, a group of follicles begin to grow, but only one grows big because there is enough hormone to support the growth of just one follicle. And that becomes the dominant follicle. And round about the middle of the cycle, it tends to ovulate and release the egg. In an artificial cycle or with ovarian stimulation, what we do is we start injections on day 2 of your period. So these injections are given so that we can rescue every follicle which is destined to grow in that particular cycle. So we get a good group of eggs growing. And when these follicles have reached the desired size, and this usually takes about 10 days of injections, then we give you the trigger injection. Now, this trigger injection helps the eggs within the follicles to mature. And then one day later, we perform what is called an egg pickup. So this is done under sedation, so you'll be asleep during the procedure. It is a simple procedure, it takes about 5 or 10 minutes, and it has minimal side effects. So if you wish to know more about the procedure, I'm sure you can ask the fertility center you're going to before you do egg freezing.
That was so informative, Dr. Vani. So my next query is, how are these eggs frozen?
In 1986, the process used to freeze eggs was called slow freezing, but the survival of eggs with that process was poor. Now we have an amazing technology called vitrification, which is instant freezing, and the survival rate of eggs after thawing is greater than 90%.
One last question that I need to pose is it guaranteed that I will get pregnant after freezing my eggs?
There is no guarantee that you will get pregnant with the eggs we have frozen. It depends, first of all, on the age of freezing. It depends on the number of eggs which you have frozen, and also it depends on your partner's sperm sample. And finally, your uterus must be normal and receptive to the embryo for proper implantation. Now, to understand this better, I need to explain a little about how the ovaries work. Well, I've said this many times before, and I think it's worthwhile saying it again, that eggs don't last forever. A baby girl is born with about 1 to 2 million eggs in her ovaries, and by the time she reaches puberty, she has about 300 to 500,000 eggs left. The decline is consistent and steady thereafter, and after 35 years, there is a steep decline in egg number, and at 40 years, very few eggs are left. Now, this decrease is not consistent or the same in different women, and each woman tends to lose eggs at a different pace. After 35 years, there is also a marked decrease in egg quality. And so, women who are greater than 35 years may take a longer time to conceive, are at higher risk of having a miscarriage, and also some of them do have babies with Down syndrome. So this loss in egg quality and quantity is both inevitable as well as irreversible. Now, when you look at egg freezing, if a woman chooses to have egg freezing at 28 years and then chooses to have an embryo made and transferred at 38 years, the egg retains its quality. So egg freezing is basically a means of circumventing the effect of age on the quality of the eggs. Finally, a few words of caution. Egg freezing is not a panacea for pregnancy postponement. There is no guarantee that you will get pregnant with these eggs. There is no guarantee that you will need these eggs. You may conceive even before using them. And also, pregnancies at a later age, that is around 40 years, can have added complications like a rise in blood pressure, diabetes, increased cesarean section. Therefore, it is very important for you to make a prudent decision, and if you have any concerns or you need more clarity, please approach your fertility specialist for further discussion. Thank you.